Thank you very much. Good morning, everybody. President of the Academy of Medicine, President of the Foundation of the Academy of Medicine, Secretary General, Professor Misra, Director of AIMS, ladies and gentlemen. I'd like, first of all, to thank our hosts today at the Foundation of the Academy of Medicine for organizing this meeting to talk with our eminent counterparts who've come especially from India for this second Franco-Indian Forum. As stated at the outset, this, of course, is the second forum. And according to what we've heard so far, the first was a resounding success and enabled people to gain knowledge about existing partnerships, existing programs, and above all, single out new thrust for the development of new forms of cooperation. For the French Ministry of Health and Social Affairs that I'm representing today, this meeting today is symbolical in two ways. First of all, as recalled, this meeting highlights the mutual interest of both our countries in the field of health. India and France have a close relationship based on trust and friendship. Since 1998, this has led to the development of a strategic partnership. The fruit of this cooperation can be seen in various projects. And then there was the first state visit of the new Indian Prime Minister in April 2015, followed by the visit of Mr. Holland, the President of the Republic, to India in January 2016. Of course, this highlighted this cooperation between the scientific and medical communities in both our countries. Some forms of cooperation have moved forward a great deal. For example, since 2009, we have cooperation between Lariboisière Hospital and the Jawaharlal Institute of Postgraduate Medical Education and Research. Other programs are being built up with the teaching hospital in Réunion on vector-borne diseases, for example. This dynamic movement brings us together today and will enable you in Toulouse to begin a new cooperation in the area of cancerology. This cooperation embodies what close links we have. In France, the creation of the Toulouse Oncopole is unique in Europe and the fruit of national mobilization and the launching of major programs dedicated to combating cancer. Indian authorities in charge of health have also embarked on a series of ambitious activities in the area of governance and the improvement of healthcare services. Together with other leading medical institutes, the AIMS has thus rounded off the delivery of care which India intends to develop in the interests of its population. This institute reflects excellency in the area of training, research, and care. Of course, healthcare delivery is a major thrust in terms of public health, focusing on non-communicable diseases, cardiovascular diseases, diabetes, high blood pressure. These are three priorities for India as for France. This is why I would also like to see how we can continue identifying a number of topics of common interest. I can't cover everything, of course, but I think it's in our interest to develop fields of work in these areas together between our two countries. You have touched on certain aspects, Professor Misra, but I want to refer to the public policy of prevention and health delivery. We've talked about cancerology and the Cancéropole in Toulouse. A third cancer plan was announced in January 2014. It takes account of innovation and research, but also lays emphasis on prevention. Indeed, this is very important in terms of combating cancer. In France, of course, we have 50% and now 60% of cancer patients who are currently treated in France. We have a prevention campaign based on combating smoking. We have a national program which stands out, and you may see this, in fact, in Paris as you move around. It stands out because we have introduced what is known as plain packaging. That was introduced for the first time in the world in Australia. You were talking about the number of young French people who smoke. About 26 people between the ages of 12 and 25 are regular smokers. So this is a major thrust in our prevention program. We need to inform young people, schoolgoers. Indeed, this is the very foundation of any prevention policy. France is very keen to exchange with India on how to combat smoking, the prevention and awareness building of the population in the area of non-communicable diseases, particularly cardiovascular disease, diabetes, and hypertension. Exchanges can be organized on academic studies on the social determinants of these diseases and the way of preventing them. As you may know, we have recently set up an agency called French Public Health, which is in charge of epidemiological observation and surveillance of the state of health of the population, prevention, health education, and everything concerning a warning system and health crises. For example, we have a network for monitoring outbreaks of flu. There's another thrust, which might be the development of what I mentioned earlier on, that is hospital-based partnerships. I referred to what we already have in Pondicherry with Gypmer. There are other exemplary partnerships that can be developed in the area of emergencies, for example, ultrasound, teaching through clinical cases and hands-on sessions. Also, in terms of emergency, triage, the caring for emergency patients. I would like to single out the programs developed by the Curie Institute in India in the area of cancer. We might also mention requests from the Calcutta hospitals, who have on several occasions said how interested they would be to develop cooperation with the teaching hospital in Montpellier in the areas of clinical hematology, cardiology, neonatology, for example. More generally speaking, I think that the dialogue you've established here, and you'll be continuing over these 2 days with the Foundation of the Academy of Medicine, may enable us to go deeper into areas like organ transplant, the organization of emergency services, emergencies relating to road accidents and trauma, disaster medicine, major burn patients. There's a third thrust you mentioned, sir, innovation in the area of health. We cannot overlook innovation in health because it is a guiding line in your work here. Also, we have many new challenges in medicine today. Here I might mention e-health, smart devices, which you mentioned, for example, and also big data, the way in which health data are used to serve the interests of the population at large. You've given us an able description of frugal innovation. We share many things in France and in India. We want to enable all to have access to high-quality care. This is a priority goal for France. This is what our public and diplomatic authorities have upheld at the UN in terms of sustainable development goals. We uphold the right to universal health coverage. When you described frugal innovation, I do believe this is a way of making available to the public at large all these new developments in health. So I would strongly encourage cooperation between our two countries. I will be keenly interested in the conclusions you will draw at the end of the day, and I think we can continue this cooperation in a number of other fields. Thank you very much for your attention.
Merci, Madame.